Hi, welcome to the second lecture of the Human Rights Lecture Series. In this lecture, we will dive into sexual and reproductive health and rights. We will discuss what they are and how they relate to the human rights framework. First of all, what are sexual and reproductive health and rights? According to the Guttmacher-Lancet Commission, sexual and reproductive health and rights, or SRHR, are defined as a state of physical, emotional, mental, and social well-being in relation to all aspects of sexuality and reproduction, not merely the absence of disease, dysfunction, or infirmary. A positive approach to sexuality and reproduction should include the impact of pleasurable sexual relationships, trust, and communication in promoting self-esteem and overall well-being. On a more practical level, SRHR implies a wide range of health issues, including family planning, maternal and newborn health care, prevention, diagnostic and treatment of sexually transmitted infections, including HIV, cervical cancer screening, infertility prevention and management. No matter how you describe it, all individuals have the right to make decisions governing their bodies and access to services. The sexual and reproductive health and rights movement started in 1994 with the International Conference on Population and Development. The ICPD Program of Action was adopted during this conference. In this document, sexual and reproductive health was recognized as a fundamental human right for the first time. It was determined that policies must be aimed at empowering couples and individuals, especially women, to make decisions about the size of their families, providing them with the information and resources to make these decisions, and enabling them to exercise their reproductive rights. This landmark document puts the rights of the people, especially girls and women, at the center of the development agenda. It shifted the conversation from reducing population growth to empowering women and girls and promoting individual choice with regard to childbearing. Since then, the discussion around SRHR continued to evolve. In 2015, with the adoption of the 2030 Agenda for Sustainable Development, the concepts of sexual and reproductive health were reaffirmed. For example, Target 5.6 ensures universal access to sexual and reproductive health and reproductive rights, as agreed in accordance with the Program of Action and the International Conference of Population and Development. This presents important opportunities for both advocates and service providers of SRHR. However, more work can be done on sexual rights moving forward. Various UN treaty monitoring bodies have addressed issues related to SRHR. Due to the importance of these rights, the Committee of Economic, Social, Cultural Rights issued in 2016 General Comment 22, dedicated to sexual and reproductive health. The General Comment codified the Committee's views on the issue, outlining the breadth of rights and services that are required to fulfill an individual's sexual and reproductive health and rights. General Comment 22 highlights, for example, that SRHR entails a set of freedoms and entitlements. The freedoms include the right to make free and responsible decisions and choices, free of violence, coercion, and discrimination regarding matters concerning one's body and sexual and reproductive health. The entitlements include unhindered access to a whole range of health facilities, goods, services, and information, which ensure all people full enjoyment of the right to sexual and reproductive health. Now that I've explained what SRHR encompasses, it is key to understand which human rights they are linked to within the larger human rights framework. In this section, I will highlight some key areas that are directly linked with the right to health. In the Universal Declaration of Human Rights of 1948, it was laid down that everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including medical care. Later, the right to health was incorporated in the 1966 International Covenant on Economic, Social, and Cultural Rights in Article 12. This right has also been included in other human rights treaties. For example, the Convention on the Elimination of All Forms of Discrimination Against Women, adopted in 1979, contains specific provisions closely related to SRHR. For example, Under Article 12, states parties are to take the appropriate measures to eliminate discrimination against women in the field of healthcare, to ensure access to healthcare services, including those related to family planning. The right to sexual and reproductive health is an integral part of the right to health found in these treaties. But what does the right to sexual and reproductive health exactly entail? Using the AAQ framework, the Committee on Economic, Social, and Cultural Rights explains that a comprehensive sexual and reproductive health care must be available in adequate numbers. Here we are looking at healthcare facilities, services, as well as the availability of trained professionals and medicines. It must be accessible both physically and economically, and it should also include information accessibility. These services or goods must be further acceptable and of good quality. These four elements are interrelated and help clarify what constitute good SRHR health services. As highlighted in the first lecture, the United Nations human rights system is supplemented by several regional human rights frameworks. The African Union has, for example, clarified an SRHR for their constituents. Article 14 in the Maputo Protocol states that states parties shall ensure the right to health of women, including SRH, is respected and promoted. This includes the right to control their fertility, the right to decide whether to have children and the number of children and the spacing of children, and the right to choose any method of contraception, the right to have family planning and education. SRHR is not only related to the right to health, but also the right to physical integrity, the right to privacy, the right to education, the right to life, and the right to be free from torture, inhumane, or degrading treatment. The principle of non-discrimination applies to all of these rights. Reproductive rights embrace multiple human rights that are already recognized in national laws, international human rights documents, and other documents. Remember from the first lecture series, states have an obligation to respect, protect, and fulfill rights related to sexual and reproductive health. Despite the obligations of the states to respect, protect, and fulfill sexual and reproductive health and rights, they are frequently violated. Examples include denial of access to contraceptives, denial of access to family planning information, denial of access to SRHR-related services, performance of procedures without women's consent, such as forced sterilization, forced virginity examinations, or forced abortion, female genital mutilation, and child marriage. Let's now look at a few different examples to see how SRHR is affected by context and communities. First, we will discuss abortion services in Indonesia. In this video, Vita, the coordinator of the SRHR Alliance in Indonesia, shares a story with us from her work.
I believe that human rights is everyone's rights, and I'm defending these rights.
My name is Vita. I am the National Program Coordinator of the Get Up Speak Out program, which is a program to empower young people in Indonesia. Just a couple of weeks ago, there is this girl, 15 years old, and the judges decided to put her in jail because she got an abortion. Well, it was actually because of the rape by her brother, especially when it comes to human rights and relations to SRHR, sexual reproductive health and rights. It's a very taboo topic, so you don't really talk about it.
This is with the case with no information, no access to services. This girl doesn't know where to go. Maybe she didn't even know that she's pregnant until it's too late. It's more than 12 weeks.
Dia dipenjara karena dia korban perkosaan dan dia menggugurkan kandungan. Enggak, kenapa kira-kira?
Ada korban, harusnya
Ya.
dia malah disupport gitu.
Ya. Jadi nanti kita bisa
Providing comprehensive sexual education is actually a good way to really empower young people so they know what are their rights.
It's kind of positive for me, at least, to see that young people are very more supportive and very more aware of these issues on SRHR. And my hope for Indonesia is to have a better Indonesia, that where the human rights is being respected, protected, and promoted, but also fulfilled by the country. And for also Indonesian people to understand that human is born with human rights and really respect that.
The government of Indonesia needs to respect. States should remove legal provisions, including criminal laws, which penalize women who have undergone abortion or medical practitioners who offer these services. Protect. States must organize their health systems to ensure that women are not prevented from accessing health services by health professionals exercising a conscientious objection. For example, where abortion is legal, if a doctor refused to perform it, the health system must refer the woman to an alternative health care provider. Fulfill. States must take steps to ensure access to appropriate health care services for women and to eliminate such barriers to the provision of abortion services that lead women to resort to unsafe abortions, including the eliminating unacceptable delays in providing medical attention. Vita is working on the ground to help empower young people to know and understand their rights. The idea being that once people know and understand their rights, they can hold the Indonesian government accountable when human rights violations occur. One way in which civil society organizations can hold national governments to account for human rights obligations will be further explained in Lecture 4 on the human rights mechanisms and in Lectures 5 to 7 on the Universal Periodic Review.
Another example where SRHR is affected is child marriage. As mentioned earlier in this lecture, all individuals have a right to make free and responsible decisions and choices regarding their bodies. However, when girls marry young, they cannot decide for themselves when to marry, when and with whom to have sex, when to have children, and ultimately enjoy better sexual and reproductive health. When girls marry as children, they are denied their basic sexual and reproductive rights. Let's move to India and Malawi to further discuss this issue. These following videos show young girls in India and Malawi who attended the More Than Brides Alliance program, in which Simavi collaborated with other organizations in trying to end child marriage through the empowerment of girls. These girls share how being married at a young age affects their lives. Let's first dive into India.
हमारे गांव पहले जो बुजुर्ग लोग थे उन लोगों का दिमाग में ये था कि लड़की बाहर जाके पढ़ाई नहीं कर सकती। क्यों जाएगी बाहर? पढ़ाई करके क्या करेगी ये लोग? हमारे गांव में लड़की को बोझ सोचते हैं, दहेज भी ज़्यादा पड़ता है, मेरा ज़्यादा बेटी है, जल्दी शादी करवा दो। 14 से 15 साल के बीच में सबका शादी हो जाता था। घर में ही रहो, घर का ख़त्म हो खेती बाड़ी तो चलो धान रोपने के लिए, तो खाना बनाओ, तो बगाली जाओ, पानी लाओ। पढ़ाई करके करोगी क्या? सारा घर का काम ही करो।
In the clip, you can see that one of the factors for child marriage of girls are poor socio-economic circumstances. Child marriage is considered as a way out of poverty. Other reasons may include social or cultural norms. It also becomes clear that this practice negatively affects and jeopardizes the sexual and reproductive health and rights of these girls, as they cannot make their own decisions on when to enter a marriage or when to have children, for example. Now that we have seen this example in India, let's have a look at another example in Malawi.
The status of a girl right now in Malawi is that she is a second citizen, because the context is that a girl will not contribute meaningfully to the development of the family. And in fact, what happens when they are giving the education, they would rather give to the boy, because they are saying the girl will be married to the husband and the husband will take care of the girl.
Child marriage in the community, some they don't see it as a problem. For example, if there's a poverty-stricken family and they have a girl child, they look at the girl as the solution. A girl who is lacking basic needs, she goes into a relationship, and from there she's getting some of the basic needs that she needs. At the end of the day, she's forced to have sex, and it ends up she becomes pregnant.
that change in the law has a huge impact, both positive, where we are seeing a lot of progress, people being afraid of the law, and also action being taken when a child has been married. But we are also seeing a backlash when it comes to the issue of implementing that law. It's very important that we should bring this law to the common person by not looking at it as a law that is just prohibiting for the purposes of prohibiting, but addressing what are the advantages of not marrying the girl child area. And that is where the issues of community awareness, working with local leaders, becomes an important component. We have to make sure that young girls and boys have access to family planning methods to ensure that they are protected from early pregnancies which lead to early marriages.
Some parents think that family planning is for only the married girls, and that's very unfortunate. Family planning is very important, especially for the unmarried girls, because these ones are still in school. So for them to stay in school, they need to have access to family planning so that they can prevent unwanted pregnancy. We can hinder their education.
Undazi ndeni masombe nyanga kuti pondaza msaniri ya chibwezi nizije ogwirisi anjitu kulela kuti uzindivikiriye kundumbu kweniso kumatenda ngakupasilana pagonani.
That is one of the things that makes me happy, to see a girl being empowered. Because if we can have many girls who are empowered like that, I don't think we'll have child marriage. Because they'll be able to stand up and say, no, I don't want to get married.
So my dream is that in 10 to 15 years from now, we should not be talking about child marriages in Malawi. It should just be an instinct that everybody says no to child marriages.
One thing I would say is marriage is no child play. And we all need to come together to give the girls the bright future they deserve.
I am more than a bride. I am more than bride.
We are more than brides.
I am more than bride.
These examples from India and Malawi clearly show that child marriage is linked to different human rights that are not being fully respected, protected, and/or fulfilled. It involves violations of the girl's right to be free from all forms of discrimination, the right to health, the right to education, the right to personal development, the right to employment, the right to physical integrity, freedom of expression, etc. These rights and many other rights are related and important in the enjoyment of sexual reproductive health and rights. At international, regional, and national level, there are many laws, agreements, and commitments to end this practice. For example, Article 16 of the Convention on the Elimination of All Forms of Discrimination Against Women states that the engagement and the marriage of a child shall have no legal effect, and all necessary action, including legislation, shall be taken to specify a minimum age for marriage and to make the registration of marriages in an official registry compulsory. This means that governments have the obligation to keep child marriage illegal by ensuring their proper registration and proper regulations like a minimal legal age for marriage. Other examples of legal instruments include the Convention on the Rights of the Child and the Maputo Protocol. But also Target 5.3 of the Sustainable Development Goals calls for the elimination of all harmful practices, including child, early and forced marriage by 2030. Despite all of these efforts, the practice of child marriage has not ended. According to UNICEF, globally, 12 million girls are married before their 18th birthday each year, and it's estimated that 650 million girls and women alive today were married as children. Therefore, it is important that states are held accountable for their obligations in ending child marriages.
In this lecture, we looked at the definitions of SRHR and how SRHR became part of the human rights framework. We highlighted the importance of ICPD Program of Action and noted examples of key treaty provisions relevant for SRHR. Through examples from Indonesia, India, and Malawi, we further explore the specific SRHR topics of abortion and child marriage. More than anything, our examples show we need to continue to urge governments to generate the change that we see necessary. In the following lectures, we will introduce several human rights mechanisms that monitor human rights implementation by states and that promote human rights for all.